I'm Amy. For those who don't know, I'm Amy Barger. I am the community manager at caregiving.com, and I coordinate the care chat. And today we are going to go into discussion about what's probably on top of everybody's mind right now, which is vaccination and a life, with society opening up to a post-vaccinated society. And, with many family caregivers here today, and with thoughts about how do they integrate them and their loved ones back into society. Is it safe for my loved one to get the vaccine with certain um, life limiting illnesses or disabilities? We're going to dive in a little bit into some of these things that might be a concern of yours as we are transitioning into making this transition during the pandemic. So without further ado, I'm going to introduce our guests. And today we have Dr. Jason Karlawish. And Jason is the professor of medicine at the University of Pennsylvania. He's the co-director of the Penn Memory Center and author of The Problem of Alzheimer's: How Science, Culture, and Politics Turned a Rare Disease into a Crisis and What We Can Do About It. And he himself is a family caregiver to his father with Alzheimer's disease. So welcome, Jason. Happy to have you here.
Pleasure to be here. Thanks, Amy.
Also joining us, and she'll be off camera today. She's not feeling well, but we have a recording that we'll share later. We have Fern Pessin, and she has been a family caregiver through many stages of her life. Throughout her life, she's cared for her siblings, her grandmother, her mother, who had bone cancer in 2006. She is the author of I'll Be Right There, a guidebook for adults caring for their aging parents. She's also a task force member for the Dementia Care and Cure Initiative Care and Cure Initiative in Florida, in an effort to make Florida a dementia-friendly state. So thank you, Fern, for being here. Even though you're not feeling 100%, I still appreciate you being here and having you here. So and also, we kind of have like a bonus guest, Sharon Thomas. She's joining us today. She's a certified assisted living administrator and a licensed nurse with a certificate in integrative mental health. And she is the founder of Sunrise Assisted Living and Health Foundation. And she's also a caregiver to her mother. So welcome, Sharon. Glad that you could join us kind of last minute and sharing your thoughts from the assisted living perspective. So happy to have you. Thank you.
Thank you so much, Amy, and others.
Okay, great. So we'll go ahead and just jump right into a brief presentation to get the conversation started. So I will get the screen sharing going. Here we go. And everybody sees this okay? Great. All right. So let's just kind of go over some basic facts about the vaccines and where we stand in the United States as far as vaccination goes. So as of 2 days ago, there have been 289 million doses given, with 132 million fully vaccinated, which is 40% of the population. So less than half of everybody's fully vaccinated right now. And so a lot of questions are stirring, with just less than half, has the CDC or retail shops are we jumping the gun, or is it perfectly safe, and are we okay? So we're just going to go into that a little bit more. Here's some things you probably have all have heard, or maybe you're thinking yourself, why are people not getting vaccinated? It's too new. I don't need it. I don't believe the vaccine is effective. I don't know what's in it. We don't know the long-term effects. That's probably the most popular one that I've heard. But with all these, everybody just really unsure, and is the confusion about whether to move forward with it or not. There's kind of, we're kind of just in a place where we're all just kind of, what do we do? How do we move forward? So with the CDC and the major retail stores removing face mask requirements for fully vaccinated individuals, and less than half of the population is fully vaccinated, you as a caregiver may be wondering, and of course, among many other questions, is it truly safe for my loved one and I to reintegrate publicly with society and see more friends and family? And how will these locations truly know who are unvaccinated while maskless? So we have our panel today to help us kind of put the pieces together. And so I would like to start with some questions with Dr. Karlawish. So Dr. Karlawish, many people in the media and on social media are coining the term post-COVID, insinuating that we are in an era of post-pandemic society, but also the term post-vaccination is used. Can we truly say we are in a post-COVID era? And what are the differences in these terms? Do you think the distinction between these terms is important?
Sure, it's important. I think in particular, we're in a post-pandemic world right now in the United States of America, I should say. So in the United States, we're in a post-pandemic situation. Our healthcare systems regionally are not overwhelmed by patients who are ill. So I think the word post is appropriate. But we're not in a post-COVID world because people still are getting COVID, still getting sick. But the vaccine's transforming where we were just 5 months ago. Namely, we had no ability other than social distancing and mask wearing to manage this pandemic. And now we have vaccines, which are quite effective. We have not one, but 3. And they've clearly shown, particularly amongst America's vulnerable older adults and residents of long-term care residential facilities, that they're effective in reducing the incidence of infection and in reducing the severity of infection if you do get infected. And that's incredibly encouraging data, incredibly encouraging.
My next question for you, Dr. Karlawish. So as I mentioned, the CDC and major retail stores are removing face mask requirements for those who are vaccinated, but it's up for debate if these locations will effectively manage those who are unvaccinated and maskless. So with your passion for bioethics, do you think going maskless at these locations is an ethical decision that is safe for family caregivers and their loved ones?
So I think that if you are vaccinated and your loved one who you have charge of and make decisions for is also vaccinated, it's okay to take off the mask and go outside. If you're not vaccinated, it is not okay to take off the mask and go outside. But if you're vaccinated, the CDC's guidelines are speaking to you, and they're saying, take the mask off and walk about, go out, go to stores, etc. The vaccine works, and you don't need a mask to protect yourself. In fact, masks really are designed to protect others who are not vaccinated if you are not vaccinated. That's what a mask is really designed for and does, and has been proven. So I'm encouraging all of my patients and families to do just that, if they're vaccinated. And I'm encouraging them to get vaccinated.
Great. Next question. So how can caregivers find ease during this transition with, some of the confusing information going on and some of the thoughts that they're having? How can they find ease as things are opening up and relieve those worries?
Well, I think that there is ease in that shot, whether it's the 1 shot or the 2 shot. And at the end of that, it's funny, many of my family members and patients tell me the sort of almost lightness that they feel that, they've crossed over to the other side and feel safe. Having said that, I think for family members who are returning, seeing someone who they've been away from for a long time, only perhaps communicating via telephone, window visits, or video, the moment of getting together physically, live and in 3 dimensions, if you will, is for some understandably and I think appropriately very emotional. I think people need to prepare for that. It's almost like coming back from a long sea journey, and being back on land with your loved ones. And it can be a very emotional experience.
So, Dr. Karlawish, caregivers and they're caring for loved ones who might have a disability or a life-limiting condition, would you recommend that they still get the vaccine, or wait for more data to come out, or is it safe now?
In general, it's safe. In particular, other countries such as Israel were a little earlier than we were to vaccinating, particularly vaccinating their older adults. And the experiences coming from those vanguard countries remains encouraging. You're right, we don't know the long-term risks, as the clock hasn't passed, but that's an ethical decision, because if you wait for long-term risks, it means you're embracing the short-term risks and you're going to accept those risks. I think the balance of the data from the wide use of the vaccines for COVID is, with the exception of the matters related to younger females and the remote risk of hypercoagulable states, I think the risks for older adults have panned out to be shown to be fairly uneventful.
Thanks, and I'm really in particular interested in your answer to this question. But with your expertise in memory care and caring for your father with Alzheimer's, how would you advise family members to talk with loved ones with cognitive or memory issues about getting the vaccine?
Well, in particular, to my own experience, it was a very straightforward, this is the right thing to do, because we have a reasonably trusting relationship, given my unique positioning. But I think if you go into it with a trusting relationship, this is just yet one more of those decisions that show the moral force of caregivers, namely how it's not just doing tasks and making, taking care of things, but it's taking on the mind of the other person and what's right, what's wrong for them. So if there's not that trusting relationship, that presents some challenges. But again, I don't view the receipt of the vaccine to be a risky approach. I think that every day in America, persons living with dementia are exposed to far more riskier things when they, for example, go to an emergency room in an American hospital and spend 12 hours on a gurney and other kinds of events. So in the scope of things that are done to the persons living with dementia in America, I put the vaccine on the lower end of risky, harmful things compared to things that we just simply allow happen to them in our system.
Okay, thank you, Dr. Karlawish, for answering those questions. During this portion of the Care Chat, I would like to share a video from Fern Pessin, sharing a little bit more about how she's been feeling during the pandemic, like prior to post-vaccination, and as we transition, her thoughts, just to give a little bit more, just to share more from a caregiver's perspective, what they're thinking. So I'll go ahead and share.
The challenges I've had during the pandemic include trying to get in to see my parents. They live in an independent living community that also has assisted in memory care, but the building basically shut down. And I love that they were so careful, but it made it hard. I would be outside talking to my parents in the driveway, the round circle, and Dad had a mask on, I had a mask on, and he's hard of hearing. So it was really hard because he couldn't always understand what I said. So he'd go and raise his shoulders and shrug. And so that was challenging. Not being able to hug them was challenging. And my mother was really, really stressed. So we, as like other families, we started using Zoom, and we had family gatherings and meetings and dinners on Zoom. And I guess my mother got really comfortable with it because a couple of weeks ago, I was on the Zoom computer, and my dad was sitting on a high bar stool at his the counter, and my mother had fed him, and I was talking to them, and she got up and started walking away, and I said, "Where are you going?" And she says, "I have to take a nap. I'm so tired. I have to go take a nap. I'm going to go in the bedroom for 30 minutes. You watch your father." I said, Mom, come back. Come back. I'm on the computer. I can't help Dad if he falls off the stool. I can't help him if he chokes on his food. You have to come back. And she was like, oh, okay. So technology is great, but I think we have to have a realistic view of what it can and can't do. Anyway, those are my challenges. So my thoughts and feelings about going back to, normal after COVID are kind of varied. On one hand, my mother is delighted to go back to shopping. She just loves going to Publix, our grocery store, and picking up things. And so she gets on her little van and she goes over there and she picks it up. She comes back, and I worry, is she out there with people who aren't vaccinated and aren't wearing masks anymore and so on. So I worry about that, especially because I'm coming to see them. So it puts me at risk. I have chronic fatigue on top of all the other stress. So I have a compromised immune system. So that worries me specifically. And actually, before all this COVID stuff started, I was very cautious anyway. I already don't touch elevator buttons, and I wipe down the shopping cart, and I, just by nature of being kind of shy. I know it doesn't seem like it, but I am. I keep a distance from people that I don't know. So I'm kind of already in that mode, and we'll definitely continue. But I will keep my eye on regulations and how people are doing, and if I need to restrict my own behavior or my parents request their behavior to change, I will do so. But right now, I think we'll be okay. I'm optimistic that our country will get back to as normal as we can. So stress in the pandemic is added on top of caregiving stress, which is extremely exhausting. And after being a caregiver for 5 years, I guess it is now, for my parents, I find that I needed a break. So recently I tried to get away and do an Ayurvedic retreat, and I went, and the guy who I was sharing the house with, it was a shared situation, was running around in just a towel. So that made me a little uncomfortable. And then I got bitten on my hikes by, I guess it was chiggers and some red ants. So I came back with bite marks and everything. So my stress-free retreat didn't turn out to be so stress-free. So best intentions, right? So that was kind of a bummer. But normally I use I have a therapist once a week, so I can share my thoughts and feelings without worrying about dumping it on people who think I'm unhinged, because we all have things that we don't want to admit that we feel as we're going through this, I believe. So I do that, and then I have a caregiver support group, and we used to meet for dinner, and now we're doing virtual, and we all miss the hugs. So I think we're going to try to get back to meeting in person once everybody's vaccinated, and that's really helpful. I recommend to anyone that I talk to who's caregiving to try to find a support group, either through friends or through an organization in your neighborhood, because it really does make a difference to manage. And the other thing I do is I do meditation twice a day for 20 minutes, and that really has been a lifesaver. That has changed my whole outlook. And exercise is good for reducing some of the stress that builds up in your body and keeps you healthier. I don't do enough of that, if I have to be truthful, but I should be doing more of that. So stress reduction for all of us caregivers is really important, and having a place to vent is also really important. So I recommend that to everybody highly.
Thank you, Fern, for sharing your thoughts. And I've got some notes that she was a little bit quiet, so I apologize. I couldn't turn it up much louder, but I think in post we can turn up the volume on her later. So sorry if you couldn't hear everything completely, but we'll take care of that in post. But so moving forward with our conversation, Sharon, I was really interested in what you're thinking as far as like running an assisted living community and how you guys are transitioning through the pandemic. So my question for you is, as you're managing your assisted living community, what does transitioning into a post-vaccinated society look like from your perspective? And what precautions are you taking, and how are you preparing residents and families for this transition?
Well, thanks, Amy. I listened to Jason and Fern, and it was good to get from their perspective, because it has not been an easy 15 months, and I think that's universal. And talking to my other colleagues, administrators, following CDC guidelines, protocols, it's been not only stressful on the administrator to make sure the environment is safe and, for the residents, but it also from Fern's standpoint, very stressful, from Dr. Jason, as well as myself. My mom is in a memory care, so I had to mask up and all that and follow protocol as I went in. So as we look at vaccination free, I really don't think that we are free. Yes, indeed, I recognize that there are things that still need to be in place, as well as the cleaning, as well as masks. I heard Dr. Jason say it, masks if you have not been vaccinated. It has been a time where all of the residents had to more or less be isolated. And that within itself caused the problem mentally for the residents. And so now integrating them back with family members, that's going to be a joy. But my greatest thing as a nurse as well is to make sure the safety of the residents. And so there is checks that still continue to be temperature checks. Make sure you are filling out what it is you need, whether or not you got your vaccine, whether or not you had a temperature. Is almost like treating it like a flu-like symptom, because we know that infection comes from outside in. It doesn't go out. So those that come in need to actually gear themselves up to follow the protocol and the procedures that are in place. I really see it as a joyful time, but also a precautionary time, because there's some employees that do not want to take the vaccine. So in turn, they have to still be masked up. And how do you encourage them so that everyone can go back to that place where we were doing things together without one wearing a mask and one not wearing a mask? It's so important from the standpoint of the administrative side for safety. And that was the key to it all, the safety of the resident. Obviously, some did pass away because of their immune system, which is down. And so from the top on down, it was a very stressful time, but following the guidelines and going in for the post-vaccination, it makes a little ease, but also with precautions still in place. And how do you do that? With family members, it's important for you to let them know that if they are sick, if they have not vaccinated, yes, they can come to see their loved ones, but also wear protective gears like the mask. Hand washing is so important as well. Certain things that we should be doing on a regular basis. COVID shouldn't have had to let us know to wash our hands and, do sanitary measures in order of cleanliness and cleaning. So those are the things the precaution of transition for the family and the residents is a safety measure. It's still doing temperature check. It's still making sure, well, it could be the flu-like symptoms. So, there are different things, but when it comes to respiratory and all that, you have to look into what the symptoms that your residents, and also to let the family members aware that it is important for them to come and see their loved ones, but also to be vaccinated in order to get that. So that we all collectively can make a statement as well for others that don't have it and are able to commune one with another.
Appreciate all that, Sharon. I'm wondering if you can switch hats a little bit from the assisted living perspective and now, back to caregiving for your mother. So I ask you, what's that been like for you, and what are you thinking about? What are you worried about? And and maybe some celebratory things, as you're mentioning, this is a good thing, and it's worth celebrating and being precautious. So.
Well, on the caregiver side, thank you, Amy. On the caregiver side, it has been very stressful. Not only on the fact that our mom has declined because of the dementia, but also taking off the hat of administrator, but putting on the hat of a caregiver, having to advocate for her, going into some of these different, when we had to interview other caregiver facilities, to interview the administrator, to interview those there. And it was quite an ordeal, but I'm so grateful that I have a great support. My siblings, we make sure we have that text thread going all the time, whatever it is, we write it in there, our concerns, and we're, as this journey goes with our mom, we're able to help others as well through the dementia, referring resources and things like that. But a support group is so important, so important. I have that in my sister, as well as others that are going along the journey as well. I make sure I do my exercises. I was jogging 3 miles 3 times a week, but end up having a torn meniscus, so I had to have surgery. But in the midst of that, it's important to find the moment to care for yourself. No matter how you give that care to somebody else, if you don't internalize that for yourself, it causes more stress on the body and on your mind as well. So that's one of my key things. I had to learn that because I'm always giving. So I had to learn how to give back to myself. And that's a key component right there. So the support is extremely good. And having the conversation with others, that's important as well.
Absolutely. Well said, Sharon. So Dr. Karlawish and Sharon, if there's anything I haven't asked or covered that's on your mind about this topic of post-vaccination in society, do you have anything else additional to add before we open up the chat to questions from our participants?
I just want to reflect how it was in a little more than a year that this all started, and look how far we've come and look what we've been through. The progress of science was spectacular in the discovery, development of the vaccine and proof of it so quickly. While we went through some rough spots as a society with how to manage infectivity, I think overall the long-term care industry really was valiant in its efforts, and the struggles to decide how to have visitors and whatnot. I think there's a lot to learn from that. And I hope that going forward, we kind of recognize that people who are visitors aren't just visitors. They're part of the care team. And going forward, how we're going to restructure long-term care in the community and in residential settings to support them and make them part of the care of the person.
I like what you just said, Dr. Jason, about the collaborative effort of everyone, not just looking at the caregiver or the family member, but bringing them in, almost like when you were in school and you had the parent, the student, everyone come together in order to have a team plan. And that's very important to have that now that we're not post-COVID, but post-vaccination. How can everyone come to the table and even talk about what it is that I can do as a caregiver to assist? Because sometimes when I call in to inquire about my mom, I don't inquire as a nurse. I don't inquire as an administrator. I inquire as her daughter. And taking off those hats, I need to know, is my mom safe? What happened? What can I do to assist in the process of you out there caring for my mom? So collaboratively coming to the table, that's extremely important. And recognizing too that there's a mental piece that goes with it for not only caregivers, but everyone involved as well. There is a mental, and it's important that if we don't understand, we get to know, come to understand what our loved ones are going through, as well as ourselves, taking care of that caregiving piece again.
Well, we do have a question from Laura in the chat. She says she's wondering thoughts on vaccinated family members and spreading it to non-vaccinated homebound parents.
So the data on that remain in progress. I think we can't say that someone who's not vaccinated, someone who's vaccinated can't be a asymptomatic spreader. But I think the experience in other countries and as well as here to date has been that a person who is vaccinated is not spreading the virus in the way of, say, someone who's not vaccinated who has been infected but isn't symptomatic. So it's not a zero risk, but again, now we're entering into balancing of risks. And I can say, for example, when I visited my father, I did not wear my mask. I was vaccinated, but I did not wear my mask, and he didn't wear his, and he was. And I said that, and we did that because I really wanted to be able to communicate clearly with him. And if there was some chance I might be spreading COVID, I was willing to accept that chance over the downsides of the quality of the communication we were going to have, being masked and whatnot, given his impairments.
Another question for you, Jason, from Mike. What affirming questions would you recommend caregivers ask themselves before they go out if they are still trying to overcome the fear of the post-pandemic world?
Is it good to be alone and isolated, or better to be out and amongst? And that's a very basic question, as old as the Bible. Two humans were created, not just because we wanted two, but we wanted two people to be together. Whether you believe the Bible is true or not, it's interesting that the logic of creating lots of humans was it wasn't good to be alone.
Absolutely. Another one for you, Sharon. What kinds of things can family members do to advocate for their facility-bound loved ones while still remaining supportive of the staff at the facility?
I think with that, obviously, you have to think of safety for mom, comfort, and care. And is your mom receiving the care she ought to be getting? Is there safety and the comfort? And so, with looking at that, you can advocate by being present in the sense of checking on mom, asking questions like you don't know, but also investigate, read up, be knowledgeable about what it is a caregiver is supposed to do. And when you find that, then you advocate for that one, because that person is not able to do for themselves or speak up. You take that seat now for the person. And because you're taking that seat, you go in and you're asking, not in an intimidating way, because here again, I spoke about collaborating with the team to let them know that you're there to help to build the care that is given to your loved one. So don't be afraid, whether it's from the administrator, from the head on down, it's your loved one. And if you are put in charge of that your loved one, it's for you to give the best care possible. So that means speaking up on behalf of that loved one. I hope that answered the question.
Okay, so we have plenty of time for more questions. If anybody would like to go unmuted and ask their question, I can certainly unmute you, or if you feel more comfortable in the chat asking your questions, feel free to ask them there too.
One other thing to add to that question, as I thought about it, because it's been stressful for everyone concerned, employees and all of that, a kind word goes a long way. So with kindness, whether it's, the other day I went to see my mom, and I stopped and bought a box of chocolate for the front staff, extending to them my appreciation for them even being there and giving care, whether it's from the first receptionist you greet up to the custodian. It's recognizing that each and every one is human and that each one is going through their bout as well. So encouragement and a kind word goes a very long way, very long way. I know it does for me.
Give everyone else a little bit more time to ask their questions. We have a comment from AMK. She wanted to add that there is a long-term care ombudsman in most states. And if this facility doesn't seem to be considering your advocacy efforts.
Yeah, ombudsman is, patients' rights. So you can write into them and let them know. There's also, you're supposed to have resident advocacy within your facility as well. So you get the residents involved. Maybe it's the cooking they don't like. Perhaps it's the way that the entertainment that you're offering them. So they have a say in the plan of their care. Now that's those that are more independent and able to, but on the other hand, those that with the dementia that has advanced, you now are that advocate to speak up for them. And that means thanks for that. Ombudsman is what you can do. Send in your comments.
Anyone else? Here's another one for you, Jason. What do you see the next 12 months looking like in the post-COVID world for children's vaccines, Plato's and vaccine herd immunity? What are your thoughts?
I can't name the vaccines. I don't remember which one, but we just saw recently one of the vaccine discover manufacturers posted results of a study that showed a notable efficacy in people 12 years and older. So we're showing now efficacy in the population who oftentimes are the spreaders of viruses, given they're going to school and close contact environments and then coming back to home. Maybe we'll take a lesson from that for the world of influenza, because one of the chief problems with influenza is it incubates amongst the youth and then it gets spread into the older adults who suffer most. It'll be interesting to see how we handle the influenza season next year. There's barely any influenza this year at all. Clearly an effect of the social distancing and mask wearing, in addition to vaccination that occurred over the last year, 2020 into 2021. So it'll be interesting to see how we as a society think about managing these infectious illnesses. Someone in the chat room posted, for example, maybe we'll see some changes in the way MRSA and other bacterial infections spread because we're more sensitive now to how we're all in this together, and your individual behavior may seem a drop in the ocean, but it all adds up to a tidal wave of problems if we don't behave responsibly. And again, I said earlier, I think that we're in for an interesting story around how hospitals and residential facilities think about the role of visitors in the care of their residents, their patients. The data on herd immunity are discouraging, namely, to get to herd immunity, you've got to have given the infectivity of the COVID virus, about 80% of people need to be immune, which would mean vaccinated. And we're just at about 50% vaccinated and supplies in excess and not being used. So unfortunately, we may not vaccinate more than 60, 70% of the population. And I think that's a failure on our part as a society, as people, individuals, as drops in that great ocean of humanity. So those are my thoughts about sort of the next several months as we get back to the routines that are so much a part of being a human.
I have a question for you, Jason. So like here in Ohio, they're doing Vax-A-Million, where if you get vaccinated, you can go into a drawing and for a chance to win $1 million. So what do you think about those sort of incentives, or are there any other incentives that you're seeing that's working, and your thoughts on those?
Well, I think in general, incentives have a role to motivate behaviors or get people to think differently about the decision that they don't seem to be able to make or complete into an intention and action. So I have no prima facie problem with Vax-A-Million ideas, nor do I have a problem with mandates in certain workspaces. If you're going to work in healthcare, you have to be vaccinated more than the place you can work, unless a reasonable accommodation can be made. But there's tough to have reasonable accommodations with a highly infectious virus. So in principle, I think, whatever works that sticks within our ethics and equal protection under the law should be done, so that we don't have another one of these. Because guess what? There will be another pandemic. Before COVID, there was SARS and MERS. There's Mexico and in the Far East, the Middle East. They didn't make it here. They petered out. But we had warnings. We had at least 2 or 3 warnings before COVID. So we've been warned because this will happen again.
Okay, so I'll give everybody just a few more minutes if there's any more questions, and if there's not, we can wrap up a little bit early. But I also wanted to share a link in the chat here really quick. If you check out the link in the chat, there's some more resources about Jason, Sharon, and Fern there at that link. So please check out their services that they've offered and the books that they've written. that can be very helpful for you in your caregiving journey. But again, give it a couple more minutes again. But I think we're good. I think everybody seems to have their questions asked. So I guess we can go ahead and wrap up. Thank you, Dr. Karlawish, Sharon, Fern. Thanks for coming.
Thank you. You're welcome.
Pleasure to meet you, Sharon.
It's a pleasure meeting you too, Dr.
Yeah.
Jason. And all the best with your caregiving on your dad.
Buzz, right back at you.
Thank you. Thank you.
Bye-bye.
Take care, everyone.
Bye-bye.